Well, hello to all my friends out there in homeopathy land. Welcome to one more wonderful Homeo Summit. I'm really excited to be here with you guys today. For those of you who don't know me, my name is Dr. Kathleen Fry. I'm a medical doctor by training. I practiced obstetrics and gynecology in Scottsdale, Arizona for about almost 30 years. And I incorporated homeopathy into my practice when I got sick myself, and it was just homeopathy that restored me to health. And when I had such a fabulous response, I became a student and I studied with Vega Rosenberg, who's a master homeopath, and I studied with him one weekend a month, every month for 15 years, where we saw live cases, which was really great. And I learned how to take care of complicated cases, how to follow people over many, many months, sometimes years. And also, I learned how to manage acute things. And I did write a book about that. My patients asked me to write a book, and I'll give you some information about that at the end. But today, I have been asked to speak to you about long COVID. So it's kind of hard to believe that it's been 4 years this month, but it was March of 2020. If you can remember when we all locked down and there were just horrible scenes in the news of people in hospitals and people dying and alone. It was just a horrible, horrible time. And so in the course of that time and over the last 4 years, I've cared for, I would say, probably almost 50 people with COVID. And I'm really happy to say that thanks to homeopathy, nobody died, nobody had to be hospitalized, and nobody that I treated from the beginning developed long COVID. Since then, I have had other people come to me who have long COVID that I've successfully treated using homeopathy. And so I want to share that information with you today. So the title of my talk, as you can see, is called Long COVID, Homeopathic Prevention and Treatment. All those letters behind my name just mean I'm a medical doctor, certified as a homeopath, and the ABIHM is I am a founding member of the American Board of the American Board of Integrative Health and Medicine. So without ado, let's get started. This is a disclaimer that the HomeoSummit has asked me to put in my presentation, just to remind you that the purpose of this presentation today is to share information with you for education purposes only. So I am not your doctor today. And this is something that if you are, as you read through this and you realize, gosh, this really applies to me and you need help, then you should find a good homeopath wherever you live. And I know in the HomeoSummit, they will give you options for how to find people. If you're interested in working with me, I do take care of people all over the planet via Zoom. And I will leave the information about my website at the end. It's just the best way for you to reach me. So without further ado, let's talk about long COVID prevention and treatment. So what is long COVID? You know, we hear this bandied around in the press a lot. Oh, they have long COVID, or you may even have someone who has long COVID, or God forbid you yourself have long COVID. But essentially, long COVID is a condition or a syndrome, which is a set of symptoms that persists after recovering from COVID-19. And many times these symptoms, they can linger for weeks, for months, some people even for years. And according to the CDC, there's about 12 symptoms that are most common when they surveyed several thousand people, 40,000 people, I think, with long COVID, and they asked what their symptom complex was. And so I'm going to touch on those briefly. And then specifically, I'll talk about how we use homeopathy to treat long COVID and also to prevent it. So the typical symptoms that most people have, it can be all of these symptoms, God forbid, or it can be a combination of some. Some symptoms can be stronger than others. Symptoms can come, they can go. It's a kind of a big potpourri of symptoms. But the main thing that people that I've taken care of who've had long COVID, the biggest thing they complain is just fatigue. You know, they get up in the morning, they brush their teeth, maybe make breakfast, and then they have to go back to bed. So that is this overwhelming fatigue, and that's also what we call post-exertional malaise, meaning, gosh, the slightest little bit of energy or exertion just wipes them out. People can often have chronic pain, either muscle pain or joint pain. Sometimes people have low-grade headaches. Sometimes if people, especially if they have a history of migraines, they are oftentimes have more commonly have headaches. People can complain of chest pain where it just hurts when they breathe. And this is especially true if people had pneumonia or were hospitalized with pneumonia. People can complain of shortness of breath, meaning they walk up half a flight of stairs and they're panting and panting. It's what we call dyspnea on exertion or shortness of breath. People complain of being dizzy or lightheaded. That's a little different than vertigo, although I have seen people who complain with vertigo who've had COVID, but more likely it's a dizziness or a feeling of being lightheaded. And of course, there's the hallmark of COVID for many people, and that is a change in their sense of taste or smell. Either they lose their smell or a sense of taste completely. Sometimes some people it doesn't come back, but fortunately there are homeopathic remedies for that that will increase your likelihood that it's going to come back. And there's a whole theory about why people lose their sense of smell, and they think it's because the virus itself attacks the little nerve receptors for smell in the nose and the top of the above the bridge of the nose. Other symptoms that people get, they'll complain of being thirsty all the time, where they just cannot drink enough water. They cannot slake their thirst. Chronic cough is another big one. And there's one particular remedy that we'll talk about in a little bit that I've seen almost everybody with COVID needed for the cough. People also will complain of a loss or a change in their libido or their sex drive, which of course, if people are tired or have fatigue, then the last thing they want to do is have a good romp in the hay, right? People also can complain of GI symptoms, nausea, vomiting, diarrhea, stomach cramps, GERD, heartburn that just won't go away. People can also have mental symptoms where they can have anxiety and depression. And this is especially true for people who have suffered with that even before they had COVID. And then there's another rare kind of thing, but kind of weird that people get when they have long COVID, and that is something called abnormal movements, where they just can't quite, they're constantly moving their fingers, or they just can't quite sit still, or their face is moving a lot. So that's something that's rare, but obviously very disturbing for people. And then another really common thing for people is sleep disturbance. They either have trouble falling asleep or they have trouble staying asleep. Or if they are able to get to sleep, when they wake up in the morning, they have, as homeopaths, what we call sleep unrefreshing, meaning, gosh, they've been in the bed for 10 hours and they feel like they need another 10 hours. So that's also a common thing with long COVID. So who is it that gets long COVID? Well, we think that it affects about 15% of patients with COVID will go on to get long COVID, which that's a lot of people around the world. On the average, it comes on about 4 weeks after the initial infection. So about a month, maybe they're starting to get a little better, but they just don't quite come back. It just lingers and lingers and lingers. People who are at risk for getting long COVID are people who have a history of other underlying conditions like allergies, where allergies are a thing where your immune system is constantly inflamed and being stimulated by allergens in the air, either food allergies or weather-related allergies. Anxiety and depression. People who have a history of that are also more prone to get long COVID. People with arthritis oftentimes will get long COVID, and that oftentimes dovetails with autoimmune disease. So people who have Hashimoto's disease, which is an autoimmune disease that attacks the thyroid. I've seen people who have a history of Hashimoto's who get long COVID. Scleroderma is an autoimmune disease affecting the skin and the mucous membranes. Rheumatoid arthritis, of course. And there are a whole bunch of other autoimmune diseases, lupus and so on. And people who have those diseases are at more risk for getting long COVID. People with asthma are at risk for long COVID, and people with asthma were especially prone to getting pneumonia with COVID. So who else gets long COVID? People who had a really serious infection at the beginning, where they were either hospitalized, they were in the ICU, they got intubated. People who were the sickest of the sick, they're more likely to get long COVID. People with diabetes, people either type 1 or type 2, people who are tend to be overweight or obese. 11% of people who didn't get vaccinated for the COVID vaccine are more prone to get infected, as well as 5% of people who did get vaccinated even after they got 2 or more doses of the vaccine. And unfortunately for my fair gender, women are more prone to get long COVID, which when you think about it, we're also more prone to get autoimmune disease. So there's something about maybe our hormonal system that puts us at risk for long COVID. So what's the understanding in homeopathy about what long COVID is? You know, in allopathic medicine, there's still a lot of theories. They don't know what it is. It's about, well, it's the immune system is out of whack, or there's a lot of theories about that. But in homeopathy, we understand that the reason people get long COVID is because their vital force has been weakened. So when I talk about the vital force, what's the vital force? Well, the vital force is that unseen force that we all have inside us that makes everything work. So I'm standing here talking to you, and I'm digesting lunch, and I'm growing toenails, and I'm growing hair, and my immune system is doing its thing. And I'm certainly not thinking about any of that. So the vital force is what's in charge of all the trillions and trillions of amazing things that our bodies do every day. So that vital force is what they call qi in Chinese medicine. In Ayurvedic medicine, they call it prana. And I liken it to the fact that if you are really healthy, it's like you've got a full tank. Your energetic tank is full. You sleep at night really great. And when you wake up in the morning, your tank is full of energy and ready to go. The other analogy I like to use is like if you were a tuning fork and you're really healthy, it should be like you're vibrating at like 1 million cycles a second. But then in the course of living, things happen that dampen that tuning fork. And it can be a number of things. And certainly COVID is one of the biggest things that just dampens the tuning fork and drains the tank. So it's kind of the way I like to think about it. So if you have a good, strong vital force, like I'm fortunate to have after 35 years of being on homeopathic treatment, I've not taken a prescription drug or anything over the counter in 35 years. And I've had high blood pressure. I went through early menopause. I had a lot of stuff. It's all been treated homeopathically. So if you have a good, strong vital force, that means you have good, vibrant health. You sleep like a baby. Your GI tract works without you having to take anything. You don't have to take something to jumpstart your colon every morning. You have good energy. You're thinking clearly. You have a good sex drive. You love your work. You have good relationships. That's vibrant health. And that's really what homeopathy can do for all of us. So what is it that depletes the vital force? Well, there's a lot of things that deplete your vital force. And why this is important for people who get long COVID is that if you already have your tank before you got COVID, if your tank was already half full or a quarter full, or your tuning fork was vibrating like this, then when COVID comes along, you don't have as much energy in the tank, or your tuning fork is not strong enough, your vital force is not strong enough to combat the COVID. And so then you end up with long-term COVID. So some of the things that can deplete people's vital force that set them up for long COVID, early childhood trauma or illness, kids who are on antibiotics for chronic tonsillitis or have their tonsils out, people who've been on chronic allopathic medications, because allopathic medications, I'm a medical doctor, I have a lot of experience prescribing them before I became a homeopath, and they're good for certain things, but they're, in my opinion, not good for long-term things, because essentially what they do is just suppress the symptoms and don't get at the underlying cause. Vaccinations, I've seen, is another way that depletes people's vital force. And I think it's primarily because of the vaccination schedule that we give now. I know this is really controversial, and I'm not anti-vaccine, but what I don't approve of is all these kids who get 7, 8, 9 vaccines in one sitting. So kids, I think, who've been over-vaccinated have had too many vaccines or too short period of time, or things like vaccinations for chickenpox. I think those things over time, too many vaccines can deplete a child's vital force. Chronic stress, of course, it's like imagine if you're in a stressful situation where you're constantly, it's like having holes poked in that tank, or sometimes things come along in life and you get a big hole in your tank. Poor diet, of course, is another thing that causes people to deplete their vital force. Overindulgence, too much sex, drugs, rock and roll, alcohol, drugs, things like that. Not enough sleep, overwork, all those things contribute to depleting your vital force. So the goals of homeopathic treatments, not only for COVID or post-COVID, but for everything, is to restore your vital force. And so the first thing to do is, whenever possible, is to eliminate whatever depleting factors people have. So I a lot of times have patients who'll say, well, I just want to stop all these drugs that I'm on because I have so many side effects. And I tell them, no, 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 no. That's one thing you don't want to do, is if people are on a lot of medications, if you're a homeopath, I don't recommend that you just pull people off their drugs cold turkey. It would be like if you broke your leg and you had a cast on your leg, somebody took the cast off before the bone was healed. So what I usually do in treating my clients is, if they come to me and they're on, and I sometimes see people who are on a lot of meds, which sometimes complicates taking their case. But in any case, if they're on a lot of meds, I have them stay on them and add the remedy. And as they get stronger and stronger, as their tuning fork begins to vibrate back to a place of health, then over time you can wean them off their drugs. And oftentimes I will do that in conjunction with their primary care doctor about what is the safest way to wean them off their meds. I will say, though, that sometimes I've seen this a lot in my 35 years of practice, that people who've been on medications, and I'll do their follow-up and they'll be like, oh, you know what? I just forgot to take my meds. I've been off them for about a month and I feel fine. So that oftentimes happens, where people will just forget to take their meds and they're fine. So one of the other things we want to do in applying finding the right remedy for people, is to apply well-known, tried and true homeopathic principles. And I'm not going to go into that a lot, because I know there are lots of really good presentations in this HomeoSummit on homeopathic principles, how we determine who needs a remedy and so on, how and what remedy they need, and how to give it, and all of that. So I'm not going to delve into that too much, but I will say, just to remind you, that like heals like. That means a substance, when it's given to healthy people in approving, brings on a set of symptoms. And when you see those same set of symptoms in someone who's sick, then you know that's the remedy they need. Arsenicum album, for example, is a remedy made from arsenic. Yes, it's a poison, but as you know, when we make homeopathic remedies in a pharmacy, they dilute them out many, many, many times. So a 30C, for example, has been diluted out in 100 drops of water from that first mother tincture. 1 drop of the mother tincture in 100 drops of water, pound that, then that's a 1C dilution, and so on. And then you make a 2C from a 3 and a 3 from a 2, and so on. So these serial dilutions, when you get out to 30 times, a 30C, there's like none of that original substance of a remedy, which is why you can give something, a poison like arsenic. And arsenic is one of the biggest remedies we have for food poisoning. I've personally used it when I'm traveling. 4 times I've had food poisoning, all treated with arsenicum. Never had to go have antibiotics or go to the hospital, get IV fluids or anything like that. But the reason that I bring this up is because when you give arsenicum in approving to healthy people, it brings on all the symptoms of food poisoning. And we'll talk about that in a little bit also, because that's one of the big remedies also for long COVID. So in choosing what remedy to give people, what we do is we match the symptom picture to the information that we got in the provings that we carry in our Materia Medica and have in all our books. One caveat I will say also is, when can you try to do this yourself, and when should you have professional help? I will say that treating long COVID is a complicated thing, requires good expertise, and I would not try to do this on your own. So let's just back up a little bit and talk about some of the common remedies that I've seen used for COVID, the primary ones. Every single person that I've treated, like I said, almost 50 people now in the last 4 years, they all needed these 2 remedies, and you start them at the very beginning. Aconitum napellus, which is also called aconite, and Carbo vegetabilis. So these are 2 remedies Aconite is known because it comes on suddenly. It's like, boom, it's a shock to the system. And remember, COVID was something that it was a virus that nobody in the world had seen before. So humans were we were all in a state of shock because our immune systems had never seen this bug before. And so it came on like a freight train. So every person that I treated, they all needed aconite and carbo-veg. And usually these are the first remedies I started at the very beginning when people were so sick. I gave those remedies every hour. I had one client, my first client that I treated with COVID. She got it the first week of March when they were moving their house. She and her son both got it. And she needed 8 remedies, and her son needed 6 remedies. And they needed those remedies, 8 remedies every hour around the clock for the first 24 hours. And then every 2 hours after that, depending on what their symptoms are, because they were super sick. But as I said, they didn't have to go to the hospital. They're well, didn't have long COVID or anything like that. So the main thing is those first 2 remedies, aconitum, which is primarily for shock, for anxiety, comes on, and the suddenness of it. And carbovegetabilis is a great remedy because of the weakness people have. They feel short of breath, they feel weak, their lungs will get attacked. And almost every single person I treated needed those 2 remedies. And as I said, I start with a 30C. You can give it every hour to every 2 hours. And then if they start to get better, let's say they get better and better, and then they kind of plateau or they start to slide back, then you need to bump up to the next potency, which is usually a 200C. And then how long you keep them on it depends on how long it takes for them to improve. And then these are just 2 remedies that people need, but sometimes they need many more. So these are some of the common COVID remedies that I've used in the last, several years. And I'm not going to go into detail with all of those. It's kind of beyond the scope of this presentation. But I do want to bring your attention to the one here in Arsenicum album. As I said, that's the one made from arsenic. And the people that I treated who had COVID or long COVID, who have just this low grade nausea, this anxious feeling. They kind of have, sometimes they feel cold and sometimes they feel hot. They'll get cramps in their belly. That's a classic picture for Arsenicum album. Alantha glandulosa is also another big lung remedy. Euglens nigra, Pinus sylvestris. Pix liquida is the big one we'll talk about in a little bit because that's the big one for loss of sense of smell. Crotalus horridus for people who have bleeding problems. Sanguinaria is also another remedy that people need when they have COVID, especially if they're having lots of allergy type symptoms where their nose is running, their sinuses are out of control. Basilinum, chelidonium, cuprum, dulcamara, iodinum, calibichromicum, and lobelia are also common remedies that we use for COVID. And as I said, I don't have time to go into all of those. But I mentioned calibichromicum because that's probably one of the most common remedies I found people needed, especially if they had all this sinus congestion where their head feels like it's just going to explode because it's so packed in there full of mucus and their head is pounding. And they sometimes will have this green, yellow, thicky, gooey mucus, or sometimes which they can barely get out. So you give them calibichromicum, a 30C, and start that, usually every 2 to 3 hours. And I always warn my patients, look out because your nose is going to run like a faucet. And that's what you want. You want all that drainage to come out. Other remedies that people need, mercurius, phosphorus, Rumex is a big one for the chronic cough. Sambucus stanum is also a big remedy for people when they had prolonged lung problems after pneumonia. But phosphorus is a big one I've seen a lot of people need for long COVID because they're so tired. I oftentimes call phosphorus the tea bag remedy, where the energy flows in and the energy flows right out. And the hallmark for phosphorus is people who they'll go to a party or they're around people and they are drained. They just have to leave early because they get drained by being around other people. It's a pretty common long COVID remedy. So how do you choose these remedies? Well, if you get the wrong rubric, you'll get the wrong remedy. So what's a rubric? A rubric is a listing of remedies based on their symptoms. And I'll show you some examples of those in a minute. So now that we have these computer programs, when I first started doing homeopathy, I started with a book. It was this one. It was Kent's Homeopathic Repertory. And when I first started on this, I basically would take a case with this book and 4 pieces of graph paper that I would tape together. And it would take me hours and hours to put together, to do a case, to work on a case. But now we have a computer program, several of them, that actually put all of this information from thousands and thousands of books from millions and millions of people who've been treated over the last 300 years. It's all combined in repertories and in what's called a materia medica. That's this. And then a repertory is basically an index to these books. So in the computer program, if you sit down and you just put down every single symptom they have, 12, 15 symptoms, garbage in, garbage out. So what you'll get is just a big mess, and you won't know which one. Could be this, could be that, tear your hair out. So instead, I find a few well-chosen rubrics. The main thing you want to look at is when people tell you, well, this happened and I've never been well since then. That's like a gold mine as a rubric, because that's a very one that oftentimes will guide you to the right remedy. Hallmark symptoms means the symptom that's pretty typical of a remedy. So the hallmark symptoms of arsenicum album, for example, are just what we talked about: cramping, belly pain, anxiety, cold alternating with fever, belly cramps, nausea, and so on. And then, of course, any mental or emotional symptoms that people have, where they're like, I never used to be an anxious person, and now I'm just like a nervous Nelly. That's important. So here's what it looks like in a rubric, for example. So these are some of the common rubrics I found for long COVID. And you can see, so here, for example, in the mind section is a remedy that I often see, a rubric I often use for people with long COVID: despair of recovery. I mean, if you've had COVID for 6 months, the common thing people tell me is like, oh my God, am I ever going to be well? And they just give up. And so if you can see that first word there, ACON, that's aconite. And if you see in the second line, ARS, that's arsenicum. So these are the remedies that are there in bold, that are capitalized and underlined. Those are really common remedies. So when people have despair of recovery, like, oh my God, I'm never going to be well again, those ones that are capitalized in bold and underlined are oftentimes the first remedies you think of. So here's another rubric that I often find very helpful, and this is especially helpful for homeopaths, is don't forget that COVID was essentially a kind of flu. So in the clinical section under influenza, you'll see again, there's 255 remedies there. So I often tell homeopaths, don't forget, that's really a really good rubric when you're looking at treating long COVID. Some of the other symptoms that people have are rubrics that we use. So when people complain of being tired or fatigued, the rubric we often use is one called weakness. Well, there's 1,286 remedies for weakness. There's weariness, where there's 835 remedies for that. But if you can get a history where someone says, God, I am so tired, and the least little thing that I do makes it so much worse, that's a gold mine, because that's what we call weariness. Motion aggravates, meaning they get up and they move around and they just have to go back to bed, and there's only 20 remedies there. So that's a great remedy. And as you can see in this, on that third line under the weariness, motion aggravates, you'll see where it says picric acid. That's a very common remedy for people who either have chronic fatigue syndrome, either from COVID or something else. The other thing I find is really helpful is in Vega Rosenberg's repertory on the acid remedies. Oftentimes, when people have acids, are oftentimes remedies that are used for people who are just wiped out and depleted. And so there's 38 of them, and I've used, I would say, probably about half of them for people with COVID and long COVID. So people who have chronic pain, again, in the generalities section under pain, 1,746 remedies for pain. So what you have to do is basically see if you can narrow it down. And here's a beautiful rubric in this generalities section: pain after influenza. There's only 11 remedies there. And the ones that I've put in capitalized and in bold, gelsemium, that's a really big remedy for flu. Gelsemium is a great remedy for people where the first symptom, or one of the first symptoms, that they just feel so achy, like their whole body, especially their muscles, really ache, and they are wiped out and tired. And they can sometimes feel anxious, especially about, oh my God, what's going to come next? And we'll talk about that in a little bit more. It's a big remedy for ailments after anticipation. Rust Tox is also another remedy that's for pain. And this is a classic remedy for people who wake up in the morning and they are super stiff. And then once they get going, they start to feel a little better and they're okay. But if they overdo it, boom, all their pain comes back. So that's rust toxicodendron. That's a really it's a big remedy for arthritis. I had a client that came to see me as a GYN patient, and I was taking her history and I asked her about meds she takes, and she says, oh, every night before I go to bed, I put a 400 milligram tablet of Motrin next to my bed with a glass of water, because when I wake up in the morning, I have to take the Motrin before I can even get out of bed. And we started her on Rust Tox, and that remedy was like life-changing for her. The other remedy, Thuya, is also a remedy for people who have pain after the flu. And this is also an important remedy for COVID because it's a remedy for the prevention of treatment of ailments from vaccination. So if you have somebody who had a vaccination and they had a really bad reaction, Thuya is the first remedy to think about. And oftentimes you want to they may need it. I had somebody that needed it every hour for 24 hours after they got the first COVID vaccine. Another rubric that I like for shortness of breath is this one in the respiration syndrome symptoms section. And again, you can see that ACON one in the first line there. I wish I had a little pointer, but I don't. But in any case, aconite is there also. So oftentimes when people need aconite, they'll have this feeling of like, God, they're just have dyspnea on exertion, where they start to breathe and when they walk or do any kind of activity, they're aggravated by exertion. Constant thirst, 162 remedies for constant thirst, but right there on the first part, you see aconite. So you can see that's also why that is a common remedy for post-COVID. And then again, the loss of sense of smell is in the rubric smell, loss of, or wanting, 147 remedies for loss of smell. But the most common one I find is a remedy called Pix Liquida. Looks like I need to fix that slide. It's Pix Liquida, not Pix Liquid. And I usually start with a 30C several times a day. And sometimes they'll start to get their sense of smell comes back, and then it just kind of plateaus and they don't make much more progress. Then I'll usually add a 200. But sometimes it can take weeks for the sense of smell to come back. And then again, there's 164 remedies for loss of your sense of smell. And there you can see aconite at the very beginning, the first word. So you can see that's a pretty common remedy for post-COVID, long COVID. But there are a lot of remedies for loss of taste. And so basically the choice of remedy depends on the whole totality of their symptoms. Another common thing we see for people with long COVID is this chronic cough. And this is the rubric I like for cough after influenza. Rumex, you'll see that listed there in the bottom third line, RUMX. That's a big remedy for chronic dry cough. But the one that's not listed here that I have found that people have needed the most is a remedy called Spongia tosta. And we'll talk about that in a minute. So for people who have anxiety, there are many remedies for anxiety. There's anxiety about health. There's anxiety about people's sexual health. There's 14 remedies where people are like, oh my God, am I ever going to be able to make love again? Then if they're anxious about that, then that's a place you go to look for a remedy. So going back to the one about the chronic cough, Spongia tosta, which is made from a burnt sponge, and it's for this kind of constant dry cough that I see a lot of people have after COVID. And it kind of starts with a tickle in the throat, and it's worse when they're talking. So at the very beginning, I usually recommend you take the 30C about every 4 hours. And then, after a day or two, as the cough gets less and less, then you can go to every 6 or 8. Then you can go to 3 times a day. And I usually recommend that people stay on the remedy at least a couple of times a day until the cough is completely gone. Then they take 1 dose a day for about 3 days and then stop. And that's to prevent recurrence. moving right along, decreased libido in women. You can see why this is a challenge for homeopaths because there's 197 remedies. The good news is there's 197 remedies, which means usually in here you're going to be able to find a remedy that's going to help people's sex drive come back. And for men, it's even worse. There's 319 remedies for diminished sex drive in men. Other common symptoms that people can have with long COVID are GI symptoms. They either get chronic heartburn, diarrhea, constipation, or bloating. Oftentimes they, fixing their diet can help. There's a great book I like by a new book out by a GI doctor, Dr. Bolsowitz, called Fiber Fueled, which is a really good book for helping people with constipation and bloating. And the choice of the remedy depends on matching their symptoms. So the important thing is paying attention to what kind of symptom they have. Is it, if they have diarrhea, does it alternate with constipation, or is it just constipation? If they have heartburn, are they nauseated with it, or is it just heartburn? Is it worse when they lay down? Is it worse after certain foods, and so on? So you want to get pretty specific about their symptoms and what makes it better and what makes it worse. Yes, people will tell me, oh, my heartburn is worse after I have pizza or spicy food or red wine. Those things are important. Other common symptoms that people complain about, which are rare but has been reported, are these abnormal muscle movements. And these are the rubrics that for homeopaths we're interested in. You will find it in the extremities section under involuntary motions, irregular motions, or automatic motions. So those are all helpful. Sleep is a big problem. And we have tons and tons of remedies, 875 for sleeplessness, 587 for disturbed sleep, 435 remedies for sleep unrefreshing. So I bring this up just to show you that, yes, we have over 5,000 remedies. And if you can find a remedy and a rubric that matches you or your client's symptoms, you have a greater possibility of being able to get a good result. So how do we determine what potency to give and how often to give it? People are like, well, should I start with a 1M because they're so sick, meaning it's diluted out 1,000 times. So a word about potency for the people who may not remember this or don't know it. So how you make a remedy is you take the mother tincture, like arnica, for example, is made from a mountain daisy, and they grind that daisy up and they put it in water. That's the mother tincture. And then they take 1 drop of that mother tincture and put that in to a little vial with 99 drops of water, and then they pound it, usually 100 times or so. That's a 1C dilution. Then you take 1 drop of that 1C dilution, put that in 99 drops of water and pound it. That's a 2C dilution, and so on. And when you get to a 12C, when you've diluted it out 12 times in 100 drops of water, so this is for all you chemistry nerds out there, you have 12C is equivalent to 1 over Avogadro's number of molecules of the original substance. So Avogadro's number is like 6 times 10 to the minus 28. So it's a big number, meaning that when you've diluted this out 12 times, you have essentially nothing left of that original substance. But the reason that the remedies work is because as you dilute out that physical component, you strengthen the energetic component. Remember that component that's important for tuning your tuning fork? That's the energetic component. And that's how the remedies work. They work on the tuning fork. They don't work biochemically like antibiotics, for example, or herbs. So the frequency, how often, so I usually start with a 30C. Sometimes in kids, if you can start with a 9 or a 12, but most of the time they can tolerate a 30C, especially if they're pretty sick. I usually start with a 30C and give it every 4 hours or so. And then, as I said, you start to slowly taper it off as their symptoms improve. But if they're super, super sick or they have a really high fever, sometimes you have to give the remedy, every 15 minutes. And so I'm giving a talk later on called Mommy, I Don't Feel Good, on colds, flus, and fever. And we'll go into that a little bit in more detail. So as I said, in the first 2 cases that I took care of with COVID who were super, super sick, she needed 8, he needed 6, and they needed them every hour for the first 24 hours, or they had to set their alarm and take the remedy every hour. And then the next day they needed it every 2 hours. And then the next day after that, they needed them every 4 hours, and so on. And then if your improvement stalls, meaning your symptoms are starting to get better, and then all of a sudden you're not making progress or you're starting to backslide, then what it's like you need to whack the tuning fork again and go up on a 200. Most of the time for acute COVID, I haven't found people who needed much more than the 200, but I did have some people who were super sick and they went through the 30, the 200, the 1M, the 10M, but that was kind of unusual. The most common mistake that people make in pretty much in treating anything is they stop the remedy too soon. As soon as they start to feel good, they're like, oh, good, I'm good. And then they are more likely to relapse. So I recommend that you begin to wean slowly as your symptoms start to improve. So let's say you've been doing pretty well. You've been on the remedy, every 6 to 8 hours for a week, and you're starting to feel pretty good. Then you can wean down to, 3 times a day. And then you do that for a couple of days. But if you get to the point where the improvement stops or your symptoms start to come back, then you kind of stay where you're at. So you're like, okay, if you tried to go to instead of going from 4 times a day, you try to go to 3 times a day, but you notice you're starting to backslide, go back to taking it 4 times a day and then continue to do that until you improve. And as necessary, you may need to go to a higher potency. I usually recommend people continue all the remedies until their symptoms are all gone. And that sometimes can take a week, 2 weeks, a month. And then I have them take 1 dose a day for about 3 days and then stop it. And that usually will prevent a recurrence. And sometimes people can need remedies for several weeks and they may need more than one. So that's pretty much in a nutshell how to prevent and treat COVID. If you're interested in learning more about me, you can go to my website at drkathyfry.com. If you want to know more about this book I wrote, my patients asked me to write this book because they'd say, oh, you know what? Every time I get a cold, you tell me what to take. I write it on a sticky note and I forgot what it was. Can you just put it all in one book? So I went to the health food store and I took pictures just of the remedies you can only get in the health food store. And I wrote the book about that. So it's basically about acutes and you can get it on Amazon. Well, thank you so much for your attention. I hope I didn't explode your head too much, but I mainly want to leave you with the idea that homeopathy is really, really powerful. And I say this as a medical doctor who used to be a surgeon, that it's the most powerful form of healing I've found. And especially for people who've have COVID or had COVID, or God forbid they have long COVID, don't despair because there is treatment. So thank you so much for your attention. I hope you enjoy the rest of the summit. Take care.